Surgeons had to literally cut open Lindsey Vonn's leg to save it from amputation and potentially save her life as well. Let's take a look at the emergency procedure that was done immediately after Olympic skier Lindsey Vonn crashed and shattered her tibia into pieces. I'm Doc Sharky and I'm a critical care, trauma and anesthesiology doctor. So the procedure performed is called an emergency fasciotomy, and a lot of viewers didn't really understand why or what it involved. And yes, it means making several deep cuts into the leg following a trauma or injury. So let me explain. If you ever had a sprain or injured your joint or leg, you would have noticed there's some swelling, and this is due to the process of inflammation and fluid accumulation that takes place after an injury. And the usual things we do to treat it can be summarized by the acronym RICE. That's rest, ice, compression, and elevation. But in the case of an injury like Lindsey's, where her tibia was smashed to bits, the inflammation and bleeding from such a massive trauma can cause severe swelling. Now, the swelling in itself is not deadly, but the swelling can cause something called compartment syndrome. Now, what are compartments and what is compartment syndrome? Now, your arms and legs are divided into what we call muscle compartments. Groups of muscles are separated from each other by sheets of what we call fascia. Fascia is a tough connective tissue, and if you ever had a steak, it's the chewy gristle that's on the outside. So if we take a look at this diagram here, you can see that we've taken a section from the middle of the calf, and if you look from the top, you can see that the muscles are here and they're separated by these sort of thin whitish connective tissue, which we call fascia. You can see there's a section here around the bone itself, and it separates the muscle. So this is your tibia and this is your fibula. And if you take a look, you can see that it completely covers it and it's inelastic, so it's tough. And if you take a closer look, you can see embedded inside the muscles are blood vessels and nerves. So this is important later on, and I'll explain why. So the problem is that when the muscles in these compartments swell up, the fascia stops it from swelling outwards, so pressure builds up in these in these muscle compartments, and that is the crux of the problem, and this is what causes what we call the compartment syndrome. But why is this deadly? Won't the swelling subside eventually? Now here's where it gets interesting and a little difficult to follow, but bear with me because all it needs is a little common sense. Now you should know there are blood vessels and arteries and veins running through the muscles within these compartments, as we've described. The blood in these vessels exerts a certain pressure themselves, and the blood flowing through these vessels is essential to provide the muscles with oxygen and nutrients, and also to take waste products and excess fluid away. Now, when the pressure in the compartment increases because of the injury and the swelling, this exceeds the pressure in the blood vessels. This causes the blood vessels to collapse inwards. And when they collapse inwards, what happens is the flow of blood in these vessels comes to a halt. The first vessels to collapse are the veins, and you can see these veins, they're sort of the bluish colored vessels there, and they tend to have a lower pressure in them, so they collapse faster. Now, the veins serve an important function in that they take waste blood and excess fluid away from the muscles and back to the heart. When they stop flowing, they stop taking fluid from the injured part, and this fluid accumulates and makes the swelling even worse and further increases the pressure in the compartment. This is the first part of what we call a vicious cycle. As the compartment pressure keeps on increasing, it eventually causes these red vessels, these arteries, to collapse as well. These are high pressure vessels carrying oxygen and nutrients to the muscle. When they stop flowing, the muscles are starved of oxygen and energy and start to die. This process causes further inflammation and release of toxic substances and even more swelling again, leading to a vicious cycle. So you might be thinking, fine, so what? The leg may just die and fall off, right? Wrong. When the muscles in a large limb like your legs start dying, the muscle cells fall apart and can cause something called rhabdomyolysis, which is characterized by the release of a protein called myoglobin and massive discharge of electrolytes, especially potassium, into the blood. This can lead to kidney failure, and the electrolyte surge can cause your heart to go into funny rhythms and can be fatal. And that's not all. As the muscle cells die, there's a release of what are called inflammatory mediators that cause widespread inflammation in the rest of the body, triggering what we call a systemic inflammatory response syndrome, or SIRS. And this is really dangerous because it can cause multiple organs to fail and can be fatal. I have treated many patients with SIRS in the ICU, and it can be very challenging, and invariably it is life-changing, if not fatal. Some of the other consequences, if you survive, can also be quite debilitating. Not only muscles, but also nerves can be damaged or destroyed, leading to weakness and paralysis. So if Lindsey Vonn's injury was bad enough to cause compartment syndrome, then yes, it could have been fatal. But luckily for her, her surgeon quickly recognized it and treated it. Yes, one way to treat it would have been an amputation, and I've had many a patient who needed to have the limb taken out because it was just too far gone, and keeping it would have been fatal. The other option is what's called a fasciotomy. The word is derived from the two words fascia, which we already mentioned is the tough gristle separating the compartments, and the suffix tomy, derived from the Greek word tomia, meaning to cut. So fasciotomy is literally cutting the fascia, and it's done as an emergency procedure, and they literally cut the skin down and through, right through to the fascia in several places to release the pressure. These cuts are not closed and left as is till the swelling goes down, and later they go back into the operating theatre for it to be closed up again. For Lindsey to have undergone an emergency fasciotomy prior to having her fracture fixed would indicate that she had pretty bad compartment syndrome that could have led to an amputation or even put her life at risk. If you had this knowledge beforehand, would you have taken the chance if you were in Lindsey's place and gone down the slope? Let us know in the comments, and while you're at it, you can check this video here where I go deep on Lindsey's injury and how it could have been devastating for her life going forward. And check out the other video of Jake Paul down here, the famous YouTuber turned boxer who might be brain damaged after a disastrous mismatch where he had his head caved in by a professional champion. These are sort of two examples of sportsmen and women who took it maybe a little far. That's all for now. See you in the next one. Stay healthy, stay safe.